Dear viewers, welcome to our learning community. We share medical education and MCQ practice to help you succeed in international exams. Each video is designed to build understanding, inspire success, and make learning enjoyable. Together, we grow and create a brighter future. Today, we'll explore how the human body moves and the different planes used to describe these movements. A plane is an imaginary flat surface along which body movements occur. Movements are described based on the plane in which they happen. The most common planes are the sagittal plane, the frontal or coronal plane, and the transverse, also called the horizontal plane. Understanding these planes helps us describe and analyze how the body moves. The sagittal or median plane divides the body into right and left parts. The frontal, also called the coronal plane, separates the body into front and back, or anterior and posterior sections. Finally, the transverse or horizontal plane divides the body into upper and lower, or superior and inferior parts. These planes give us a framework to describe body positions and movements precisely. An axis is an imaginary line around which the body, or a limb, rotates. Every movement in a plane occurs around its corresponding axis. Understanding axes helps us link specific movements to the planes in which they happen. Physical activity is made possible through movements and motions. Each movement occurs in a specific plane and around a corresponding axis. Movements can also be classified by type, such as flexion, extension, rotation, abduction, and adduction, which help us describe how the body moves. Flexion occurs when the angle between two bones at a joint decreases, like when you bend your elbow or knee. Extension is the opposite. It happens when the angle between two bones increases, such as when you straighten your elbow or knee. Hyperextension occurs when a joint is overstretched or bent backward beyond its normal range due to an exaggerated extension motion. Examples include tilting the head far back or bending the wrist backward beyond its usual limit. Abduction is the movement of a body part away from the midline, like raising your arm or leg to the side. Adduction is the opposite. It's movement toward the midline, such as lowering your arm or leg back to your body. Internal rotation occurs when the front of a body part rotates toward the midline, such as turning your arm inward at the shoulder. External rotation is the opposite. It happens when the front of a body part rotates away from the midline, like turning your arm outward at the shoulder. Circumduction is a movement that combines motions through two or more planes. It creates a circular or conical motion of a limb. A common example is moving the arm in a full circle at the shoulder. Supination is the rotation of the forearm so that the palm faces upward, like when you hold a bowl of soup. Pronation is the opposite, where the forearm rotates and the palm faces downward, as when pouring out soup or typing on a keyboard. Medial rotation is the inward rotation of a body part toward the midline, such as turning the thigh inward at the hip. Lateral rotation is the outward rotation of a body part away from the midline, like turning the thigh outward at the hip. Dorsiflexion is the flexion of the foot at the ankle, where the toes move upward toward the shin, like lifting the front of the foot while standing. Plantar flexion is the opposite, an extension of the foot at the ankle, where the toes point downward away from the shin, as when standing on tiptoes. Inversion is when the sole of the foot turns inward toward the midline, like rolling the foot inward at the ankle. Eversion is the opposite, with the sole turning outward away from the midline, as when rolling the foot outward at the ankle. Flexion decreases the angle of a joint, like bending the elbow or knee, while extension increases it, as when straightening the elbow or knee. Abduction moves a limb away from the midline, such as raising the arm sideways, and adduction brings it back toward the midline. Internal, or medial, rotation turns a limb toward the midline, like turning the thigh inward at the hip, whereas external or lateral rotation turns it outward. Supination rotates the forearm so the palm faces up, as when holding a bowl of soup, and pronation turns the palm downward, like typing on a keyboard. Plantar flexion points the toes downward, as when pressing a gas pedal, and dorsiflexion lifts the toes upward toward the shin. Inversion turns the sole of the foot inward, like rolling the ankle inward, while eversion turns it outward. That brings us to the end of today's lecture on the anatomical planes and movements. Thank you for watching. If you found this lecture helpful, don't forget to like, subscribe, and hit the notification bell so you won't miss future lessons. Keep learning, stay curious, and see you in the next session.